It's great to have the opportunity to talk with you today about some exciting work that's being done in terms of optimizing brain health. I've been involved with cardiovascular disease and primarily cardiovascular prevention for decades. And as we reverse underlying cardiovascular abnormalities on many levels, I've always suspected and pretty much was positive that we were protecting the brain as it ages and develops various diseases, but I could never measure it or prove it. In the cardiovascular system, we measure things in three different levels. Anatomically, we want to look for the plaque that clogs arteries and various other issues. And then physiologically, look at the various forces around the development of clogged arteries and related oxidation and inflammation. And then biochemically, look at a lot of new and cutting-edge biomarkers that might illustrate cardiovascular strain or stress or clogged arteries or damage. So in my practice, we're always trying to normalize those through a variety of interventions with medication, vitamins, supplements, lifestyle, and have had great success in doing that, ultimately with our goal to eradicate heart disease, stroke, and related vascular entities. In the process, though, I would tell my patients we've got a great opportunity to protect the aging brain, but I could never prove it or measure it. And then I met the people from the WAVi brain scan organization. And using WAVi, I've been able to quantify brain health in some unique ways that I think has great practical applicability for all Americans, all citizens of the civilized world, basically, in terms of the ability to measure brain health simplified in a evoked potential EEG that gives me brain speed and brain power. And those two entities decrease with age. So I've always tried to interrupt the aging process in the heart, the blood vessels, the kidney, and various other organs that might be affected by vascular health. And now I might then have a way to measure the processes that are involved in the brain. With the WAVi brain scan, I can then be able to measure brain speed, brain power, and then intervene and watch those things improve and change. So as I discovered the WAVi brain scan, I first wanted to test it out on my existing patients. So I have at least 50 to 100 patients that were on the Boone Heart Institute program with all of optimization of all these variables. So I tested out the WAVi brain scan on those individuals, and it had already been shown in the football and in the concussion world with the University of Colorado, and we often are looking at using it in our work with the NFL and NFL alumni. But in that group, it showed that a concussed brain would have varying levels of low voltage, low speed, and those would be correlated with a poor brain age. But then you could see in a young athlete that the brain would heal over a period of days, weeks, and months. And if it didn't heal, they probably shouldn't go back to playing sports or football until it does heal. Well, that ability of the brain to change prompted my interest in could it work with the typical aging baby boomer as we look to preserve brain health. In many ways, I and my patients want the last organ to die to be our brain, and I think that's now possible. But we couldn't measure it as effectively as we would want. So with WAVi scan on these 50 to 100 patients who were on our protocol, their brain speed and power looked fantastic, like a 20 to 30-year-old. So that told me two things. First of all, if the WAVi brain scan would have shown abnormalities in people that I thought I was treating perfectly, then either something's wrong with my treatment or the scan wasn't measuring what I wanted it to measure and wasn't showing brain health as I saw it. But in fact, what happened was those correlated almost perfectly. So then I started using it in pre and post fashion. So I would get a baseline evaluation of cardiovascular health with all these anatomic, physiologic, and biochemical variables. And then I would simultaneously get a WAVi brain scan along with these others and track them over a year. And lo and behold, our first 15 patients who had no treatment prior to the testing not only improved arterial health, inflammation, oxidation, heart age, anything I could measure in the cardiovascular system, but their brain health on WAVi brain scanning got dramatically better as well. And that's been consistently seen now throughout our work. So I think in the WAVi scan, which is an evoked potential EEG, it can be very easily used in the primary care setting. Too often in cardiovascular disease, the leading doctors are cardiologists, cardiac surgeons, and hospitals, but they really deal with our failures. Interventions that are way too much, way too late. Even though they do brilliant work, I want to prevent heart disease earlier. In the same way, neurology and neurosurgery deal with the aging brain in a brilliant way, but way too late. I want to find brain health issues and preventive issues that I can measure, motivate, and manipulate and optimize with patients over the years. And many of the same interventions that we're using to protect the heart are actually showing dramatic improvements in brain health. And now I've got a quantitative way to measure that using the WAVi brain scan. So that's been a very exciting addition to our preventive cardiology practice. We deal a lot with executives and corporate leaders, but I think the scan has great applicability to the masses, to the primary care doctor looking for optimization and measurements in this brain health world. And the other thing it does is it dramatically stimulates care in a lot of other areas, meaning that if I've got a brain age that's a problem, I'm 42 and I have the brain age of an 84-year-old, that might motivate me to take my blood pressure, cholesterol, and other medications or approaches that might be less exciting to me as a patient, but seeing my brain age might be the motivation we need to protect from a lot of other disease processes. So I think this scan really has completed my ability to moderate and evaluate the body from head to toe and then show patients dramatic improvement, all in a subclinical way. Now the key subclinical, I don't know that we can prevent dementia or Alzheimer's once it's in full swing, but even studies out of UCLA and other mass studies of the world's populations, when we treat aggressively cardiovascular risk factors long before you have symptoms, meaning long before you're complaining about memory or other issues that might be involved with early dementias, you treat that disease 10, 20, 30 years earlier, and then with this scanning we can show abnormalities and dramatic improvement with a very simple reproducible testing situation that can be utilized in any primary care office in the country. So just as the most advanced work with cardiovascular disease is done by cardiologists, cardiac surgeons in the hospital, most advanced work with the brain are done by neurologists and neurosurgeons in severe settings. The real key to both those organs and protecting our bodies is at the primary care level. So family physicians, internists, nurse practitioner, physician's assistants, and nurses are actually, in my mind, the most powerful brain and heart doctors in the country, and they will be further empowered by such data and information as can be ascertained from the WAVi brain scan.